Welcome to the Greater Boston Food Bank's 5th Annual Ted Cutler Lecture, made possible by the generous support of the Cutler family. Thank you for joining us today as we share research highlights from our 3rd Annual Statewide Food Equity and Access Report. Before we begin, let's take a moment to understand who Ted Cutler was, his indelible imprint on the Greater Boston Food Bank, and his enduring influence on today's hunger relief efforts. The Greater Boston Food Bank stands tall as a beacon of hope for many in our community, providing 90 million healthy meals to people in need throughout eastern Massachusetts last year. One reason this was possible is because of the Greater Boston Food Bank's 117,000 square foot warehouse and the work of one very special man, Ted Cutler. When Ted passed away in 2017, he left behind a legacy of commitment and support that deeply impacted Boston in higher education, the arts, medicine, and of course, food insecurity. He believed you can't teach a hungry child. Ted was inspired to work with the Greater Boston Food Bank's president and CEO, Catherine D'Amato, to lead the $35 million capital campaign called Fighting Hunger, Feeding Hope. With Ted's leadership, the Greater Boston Food Bank was able to purchase land and construct a new food bank building in 2008 at 70 South Bay. The COVID-19 pandemic has had a devastating impact on food insecurity in our area, and pinnacle to the Greater Boston Food Bank's ability to respond, its warehouse enabled the distribution of historic volumes of healthy food over the past 3 years, and today the need for food persists. Ted's vision and commitment lives on with us today. The Greater Boston Food Bank strives to make sure every individual, family, and child has access to the healthy food they need to happily and productively live and thrive every day. Thanks to Ted and the Cutler family, we are able to work together towards one mission: to end hunger here in eastern Massachusetts. Without further ado, let's kick off today's lecture. It is our privilege to welcome our keynote speaker, Massachusetts Governor Maura Healey.
Hi everyone, I'm Governor Maura Healey. I want to start with the bottom line. Food insecurity, hunger, is something that simply should not exist in a country and a state as prosperous as ours. And yet, as the Greater Boston Food Bank and your partners once again have shown through this report, too many folks in Massachusetts continue to suffer from inconsistent and inequitable access to food. This problem disproportionately harms our most vulnerable neighbors, our children, our seniors, communities of color, and low-income families. And it also reveals the true human costs of inequality in diminished health, well-being, and security. That's why all of us must be committed to not only providing relief, but also to ending hunger and its root causes. Now, we're in a better position to tackle this work thanks to this report and everyone who contributed to producing it. I want to recognize Catherine D'Amato and the Greater Boston Food Bank for your dedication to food equity in our state. I also want to thank Dr. Fiechtner and the entire research team. Thank you to Mass General Brigham for your global leadership in understanding the connection between food security and health outcomes. And I'm grateful to our colleagues at the Department of Elementary and Secondary Education for their role in securing federal funding to support this work. This report could not be more timely. We're in a critical moment for food security. The COVID pandemic launched a historic hunger crisis in Massachusetts and all around the world. Now we've moved past this public health emergency. But with global inflation and the end of federal relief measures, the report makes clear that the crisis continues. That's why our administration's first major piece of legislation was a budget to bring relief to families who are losing SNAP benefits, and also to extend universal free school meals through the end of the school year. These are transitional supports, and the real work is just beginning. Because the fact is, hunger is bound up with so many other critical issues we're facing, from housing costs and health equity to learning loss and chronic illness. That's why our proposed state budget makes historic investments in not only food security, but also broad social and economic equity, from a new child and family tax credit to increased rental deductions and affordable housing to resources for our schools and for our veterans. Food security touches almost every state agency, and our team is taking a government-wide approach to addressing hunger. The pandemic showed us just how vulnerable our communities are, but it also showed us something else, our ability to pull together to tackle big challenges and be there for those in need. I want to give a special thanks to everyone who set up and staffed the food pantries that kept so many people and families going through some of the harshest weeks. It's that same spirit of unity and collaboration that we'll need right now to meet this ongoing crisis and end hunger in Massachusetts. The truth is, Massachusetts is a leader on food access. Other states are looking to us as a model, and that's because we have a powerful team of nonprofits, academics, hospitals, public agencies, and private sector supporters who work smart, work hard, and work together. So now I'm calling on all of us to really dig deep, to rally our team, to be there for our neighbors once again. And I'm calling on leaders and organizations who are not yet at the table to be part of the solution as well. We must meet this moment with the urgency it deserves. It's about helping those in need, and it's also about securing our state's future. We simply can't reach our potential, strengthen our workforce, and grow our economy when so many of our neighbors are being held back by hunger. I want to thank you all once again for your leadership, and I look forward to continuing our work together.
Thank you, Governor Healey. Next, please welcome Dr. Lauren Fiechtner.
Hello, I'm Dr. Lauren Fiechtner. It is my privilege to serve as the Greater Boston Food Bank Senior Health and Research Advisor, and also as the lead researcher in the collaboration between the Food Bank and our Mass General Brigham's research team. At the end of May 2023, the Food Bank released its third annual statewide report entitled Opportunities to Improve Food Equity and Access in Massachusetts, Ending Hunger Together. As our governor noted, in addition to the collaboration with Mass General, this research was generously funded through a USDA grant supported by our partners at the Massachusetts Department of Elementary and Secondary Education. This report highlights data we collected between November 2022 and January 2023 from an anonymous and independent survey administered by an online research firm. More than 3,000 Massachusetts adults were asked a series of questions about their experiences during the previous year, the calendar year 2022, to determine the prevalence of food insecurity and evaluate experiences they had with the charitable food system, state and federal nutrition assistance programs. The survey was originally adapted from the National Food Access and COVID Research Team. This was an amazing collaboration of researchers from 15 states. Over the last 2 years, the survey has evolved with input from the state, community, and healthcare partners, including the Greater Boston Food Bank's Health and Research Council. In previous years, we measured food insecurity prevalence using the USDA's 6-item short form. This year, we used the full 18-item module. The survey included demographic quotas based on the American Community Survey from the Census Bureau for income, gender, race, ethnicity, age, education, and region to ensure representation of historically unheard voices. After the data was collected, we used a statistical weighting procedure to ensure our estimates were representative of the state's population based on the census. So what's new this year? Utilizing the full 18-item module, we looked at household and child-level food insecurity rates, including severity. To contextualize this data, we also looked at trade-offs households are making and coping strategies used to get enough food. Given the collaboration with Mass General and the leadership role Massachusetts has taken around food as medicine, we included questions around food insecurity screenings and healthcare settings and referrals to community-based organizations, as well as chronic medical conditions experienced by those with food insecurity. This year, the survey was offered in English and Spanish. We plan to expand to other languages next year. In addition to looking at the whole state, we also broke it down to analyze regional data on food insecurity in Massachusetts, recognizing hunger looks different depending on where you live in the Commonwealth. And finally, to further address how we equitably solve this problem, we added questions to further understand the cultural food preferences clients using food pantries had. So what were our findings? Overall, we found that, unfortunately, even though the pandemic may seem to be ending, the hunger and affordability crisis in the state persists. During 2022, food insecurity remained high in Massachusetts, with approximately 1.8 million adults reporting household food insecurity, or 33% of the state's population. New analysis this year included severity of hunger. Overall, our data found that 20% of households were experiencing very low food security. This means that they cut the size of their meals, skipped meals, or did not eat for an entire day because there wasn't enough money for food. This year was the first time we looked specifically at households with children, and those rates were just as high, with 36%, or 1 in 3 households, experiencing child-level food insecurity. This means that a child was hungry, skipped a meal, or did not eat for a whole day because there wasn't enough money for food. Children from households where the adult completing the survey identified as Black, Hispanic, or LGBTQ+, had much higher rates of food insecurity compared with rates overall. Participation in the federal child nutrition programs like WIC and school and summer meals also increased significantly over the last 3 years. WIC was praised, but respondents talked about how the benefit amount was not enough. An LGBTQ+ white working mother utilizing a food pantry in Hampden County said, "WIC has healthier food options that are too expensive for us to pay for, even if using SNAP." A Black student mother utilizing SNAP, also in Hampden County, said, "WIC doesn't provide enough for a month, especially if you have a baby on formula." We found that the cost of living was a huge driver of food insecurity rates in the state. In the last 12 months, 70% of households with food insecurity in Massachusetts had to choose between paying for food and paying for utilities. 68% endorsed choosing between paying for transportation or food. 64% endorsed having to pay for rent or housing or food. And 44% had to choose between paying for education and food. Even more devastating were the coping mechanisms respondents shared. 85% shared that they bought the cheapest food available, which also tends to be the least nutritious. 61% received help from family or friends. 41% sold or pawned personal property, and shockingly, 30% reported watering down food or infant formula. And we found even higher rates among those who were on WIC. As a pediatrician, I found this to be extremely alarming. Regionally, food insecurity varies greatly across Massachusetts. Our study showed that 29% of households in eastern Massachusetts, the largest population in the state, are experiencing food insecurity, while Western Mass and Central Mass experience higher rates at 41% and 39% respectively. Child-level food insecurity data mirrors the household-level data, with Western Massachusetts again demonstrating the highest rates of child-level food insecurity. We suspect this may be due to varying economic opportunities based on the anecdotes that participants shared. Both food pantry and SNAP utilization was elevated over the last year, demonstrating the reliance and the success of these critical food programs. And the participants' experience improved as well. At pantries, our report shows decreasing stigma and less perceived discrimination, but more improvements need to be made. This year, more food pantry clients reported that they would recommend food pantries to others compared with last year. 54% of new clients reported starting to use a food pantry because of the increased cost of groceries. In 2022, participants' overall experiences with SNAP were excellent, improving since 2019. We suspect, based on qualitative data, that this was in part due to SNAP benefit increases, the flexibility in enrollment practices authorized by the National Public Health Declaration, statewide awareness campaigns around pandemic EBT, and the adoption of the state's streamlined application portal for SNAP and Mass Health. When asked about the increased SNAP benefit due to the pandemic, 87% of respondents worried about being able to afford enough food if the SNAP increase ended. Important to us in addressing equity in our food assistance programs was to further understand cultural food preferences. 70% of food pantry clients reported having trouble accessing traditional foods from their culture, including meat, seafood, vegetables, fruits, grains, legumes or beans, oils, herbs, spices, or kosher or halal foods. Also new in this year's study, we examined the link between food insecurity and chronic medical conditions. Food insecure participants reported members of their households were diagnosed with hypertension, obesity, diabetes, food allergies, heart disease, and malnutrition, many households experiencing multiple conditions at the same time. Rates of anxiety and depression were found to be nearly double among populations receiving SNAP benefits, those utilizing food pantries, or those experiencing food insecurity. Fortunately, among those who were screened for food insecurity by their doctor, 77% reported they were offered food resources, and 83% said that they would use the resources they were provided, proving healthcare to community interventions work. In summary, during 2022, elevated levels of food insecurity persisted in the Commonwealth, with 1 in 3 experiencing food insecurity. Reported participation and reliance on food assistance programs was the highest since the beginning of the pandemic, and the end of the pandemic public health emergency may lead to more trade-offs between food and other expenses and a higher reliance on food distribution programs, especially for those households at greatest risk. An additional burden is the lack of access to culturally preferred foods and the high levels of chronic health conditions experienced by households with food insecurity. I hope that we can leverage these findings and the report's policy and programmatic recommendations to support a continued statewide strategy to end hunger and improve health. And I welcome anyone who would like to talk more about this research to contact us, as we have even more data than we will discuss today. Now, I would like to introduce the Greater Boston Food Bank's President and CEO, Catherine D'Amato, to lead a panel discussion with 2 of my colleagues that guided this work. Thank you so much.
Thank you, Lauren. Thanks to Dr. Fiechtner's leadership, we've been able to conduct research in collaboration with Mass General Brigham Center for Healthy Weight and Nutrition Equity. GBFB has been conducting this annual research with them throughout the pandemic to examine the prevalence of food insecurity and the barriers to accessing food assistance programs. It's also been through Lauren's leadership that we've been able to build a robust health and research council to advise us on this statewide data collection, as well as other research and academic publications. This is very important to the Greater Boston Food Bank and to our statewide hunger relief partners. This is where we're able to make data-driven, community-based investments and advance public policy priorities that will have a real impact on the lives of our neighbors in need. I'm thrilled to be joined today by 2 of our Health and Research Council members, Dr. Angela Odoms-Young and Dr. Norbert Wilson.
Thank you.
Thank you both for being with us. To start our conversation off, Angela and Norbert, would you take a moment to introduce yourselves and share a little bit about how you got involved with the Greater Boston Food Bank and about the Health and Research Council?
Great. Thanks so much. As was mentioned, I'm Angela Odoms-Young. I'm the Nancy Schlegel Meinig Associate Professor of Maternal and Child Health at Cornell University. I also serve as the Director for the Food and Nutrition Education in Communities program, which includes New York State FNEP, the Expanded Food and Nutrition Education Program, one of our USDA-funded nutrition education programs through Cornell Cooperative Extension. And I'll turn it over to Norbert to introduce himself, and then I will talk a little bit about how I got involved in this initiative.
Thank you. My name is Norbert Wilson. I am a faculty member at Duke University. I have a split appointment. I am a professor of food, economics, and community in the Duke Divinity School, and I'm also a professor in the Sanford School of Public Policy. In addition to those responsibilities, I'm also the director of the World Food Policy Center, which is based out of the Sanford School of Public Policy.
Well, you both have a lot going on. So could you share a little bit about how you got involved in the Health and Research Council?
Definitely. A lot of my work is related to food insecurity. This year, I'm working with Feed in America. I'm the visiting equity scholar, working on how do we think, um, kind of working on projects to think more about how we address root causes to food insecurity. And I got involved with the Greater Boston Food Bank through not only that work, but in thinking more about how do we include equity within the charitable food system. Dr. Fiechtner, as well as Rachel Zach, who was a previous staff person at the Greater Boston Food Bank, was working on a project to think more about the measurement of discrimination. We know that this kind of racialized inequities that exist related to food insecurity. And so I met with them initially before I got became a member of the advisory and recommended some measures to be included in the survey, specifically related to equity, discrimination, and stigma.
Well, thank you. How about for you, Norbert? How did we find you all the way at Duke University?
Yes, well, actually, it started off when I was at Tufts, and maybe even a little bit before. I was at the Tufts Friedman School of Nutrition Science and Policy. When I interviewed there, I asked during the interview if I could visit the Greater Boston Food Bank, and I met some of your colleagues who were very gracious and gave me a tour, and it began a working relationship with them. And I got to know Rachel Zach in time, and then Lauren Fritchner. And through that collaboration, I was invited to be a part of the conversation around the survey that we'll talk some more about. But it was really important to have those early interactions with the Greater Boston Food Bank and to learn about the work that you all were doing. Part of my interest and reason for doing that and visiting when I did was because I had been on the board of the Food Bank of East Alabama. So I've known and worked with food banking for a while and was excited to continue that work in Boston. And now that I'm in North Carolina, I'm also engaged in the food bank in this area.
Well, we're grateful to have both of you. You've already brought so much to this council. So Norbert, let me start with you. I mean, earlier in the program, we heard from Dr. Fiechtner about how she described the methodology that's being used behind this research. And it's a question that we get asked a lot. So I understand that you had a role to play in determining that methodology. So can you share with us a little bit about how you helped the food bank arrive at how we actually conduct this survey and the methods on how we analyze the data?
Sure, I'd be glad to. So the conversation started off with the idea of doing some type of survey to understand what was going on in the service area. And early conversations were around collecting data at the food pantries themselves, working across the network. But we realized that that was going to be really expensive and pretty time consuming and also taxing on the pantries and the organizers there. And while it could be great to engage at that level, we also realized we may miss out on people who, for whatever reason, choose not to use the food pantries. And so that led to conversations with a number of different partners to see what about a statewide survey. And what the food bank ultimately decided was to go with a company, Qualtrics, to collect the data. And they've done a pretty good job of using a sample that looks like the state of Massachusetts, both in terms of race and gender and income, to make sure that they have as close as possible a representative sample. And in addition to that, they use survey weights in making sure that the people that they do have in the survey reflect who's actually in the state. And to the best of our ability and to the best of their ability, I think they've done a pretty good job of reflecting the diversity of the state of Massachusetts.
In Massachusetts, we have a new governor. And our governor and lieutenant governor have been quite verbal about issues of affordability and making Massachusetts a place where everyone, can fundamentally live and work and play and be part of the state. But this study just rings loudly on the issues of affordability and inequity. I'm curious to hear from you what you're seeing in your own work and how it relates to this study just shining a big light on the issues of affordability and inequity.
So I'll start. The affordability of food and the ability of people to use their income to purchase foods is critical. As you all know, we've gone through a pretty substantial increase in prices of food through inflation, and that affects individuals who, across the income spectrum, but particularly individuals who have a relatively low income. In some work I've done with colleagues at Tufts, we've interviewed people in multiple states, but particularly in Massachusetts. And a resounding comment that we heard is the increases in the prices of food have left them really in difficult situations. In other studies we've done, we've discovered and learned how individuals from low income households really find creative ways of trying to meet their food needs. So whenever we see increases in food prices, we know that that means that individuals are going to struggle to access food. But it's not just the prices of food, it's also opportunities for employment and a steady income. And those are critical factors. The price of food and what people are able to afford are critical for people to be able to feed themselves and their families.
And I will just add one thing to that because I think what Norbert mentioned, many times we think about only one side of that equation, but we have to also think about what people are making, wages, wages and then affordability of food. Because many of us, food is a basic need. It's something that we can't live without. And so it becomes important that people, all families, have access to the resources to make sure that they can afford food. And in at least my realm, as a person that does nutrition education, we want them to be able to afford nutritious food that is supportive and that also helps them manage their health conditions as well as reduce the potential of other adverse health outcomes in the future. And so wages, affordability of food, but then also other things where people have to spend money. They have to spend money on rent or housing, a mortgage. We always have this traditional view that there's only one type of family that's food insecure. But as Norbert mentioned, the affordability and also any type of change in wages can have an impact on people's ability to afford food, change in housing prices, changes in taxes, essentially when people have to provide more of their income. And these we know are just natural things that happen, but some families are more vulnerable than others when it comes to recovering from economic shocks. Other things like medical bills. And so many times we think, okay, well, it's just the people that are persistently poor, but it's our neighbors. Years ago, we did a study on looking at people who experienced a disability. And I remember talking to a woman who was from corporate America and had experienced a disability and went from being really pretty economically secure to being economically insecure. So we always think about, oh, it's not us, but really it's everyone. And so it's important when we think about the affordability of food, when we think about maybe potentially changes in income, that we think broader to make sure all families have access to affordable, healthy, culturally appropriate food.
All well said by both of you. The Greater Boston Food Bank believes that food is a human right, and that you said it really well, that when we just focus on food, it's such a vertical, right? But having to be able to look at all the issues that contribute to the trade-offs that families are making. And this particular piece of research shows how dramatic those trade-offs are for these families, what they have to go through each and every day to make sure that they have enough food for their families. Thank you for that. I have a question for both of you. This year is our third annual statewide report, and each year we've evolved the survey, and I appreciate, Norbert, you're just trying to help us understand how we can iterate year after year. So can you both elaborate on your role, influence on this year's statewide survey, and specifically what we're trying to understand is how you guided the food bank on these areas and how what you felt was important, to the research and to the survey data.
So I can start. I think it's critically important for the charitable food system to think more about who are they reaching, why, what might be some barriers to reaching families that are experiencing food insecurity. This statewide survey is extremely innovative to think about the broader context, not just as Norbert mentioned, surveying people that come, that are at the door, but thinking broader to understand who you might not be reaching and why. And so this survey is also important when we think about this huge, two things happened this year, which of course many things happened this year, but um or over the last several years, two things that happened that have continued to persist is the impact of COVID. We know COVID was sort of has huge implications for food insecurity. And the other thing that raised attention about just the historical impact of structural racism was the case of George Floyd. And so the kind of intersection between those two seminal events make this particular survey very relevant. And I think we also have to think beyond race. The survey does that perfectly. We understand more that race and ethnicity is a risk factor for food insecurity and the experiences that go along with racial discrimination, but also broadly, when we think about stigma and also structural oppression, we have to understand that that might range across multiple groups, LGBTQ plus, the idea of immigration and people that are coming and are experiencing things in new ways, that there might be some intersectionality that exists that put people at risk for food insecurity. And then how can the charitable food system really respond to those needs through cultural foods, through dealing with stigma? And so this survey, as I mentioned, is extremely innovative and timely and can be relevant when we think about solutions, not just understanding what's going on.
It's terrific. Norbert, do you have anything you want to answer there?
I would like to, and I really appreciate Angela's comment. And I would say Angela and I are both a part of the council, and this is, I think, a real innovation and an important way for a food bank to understand what's going on in their community in terms of talking to researchers to understand from the wealth of knowledge that's there to be able to provide support for them to do a quality survey. So I'm really pleased and happy about that activity. And it represents not just academics, but other people who are really involved in this space that bring another set of knowledge that's critical for doing a good job of understanding what are the key questions to ask and how to ask those questions. So I think that's an important part of what this survey has been doing for the last several years. In addition to that, I've been a board member of a food bank, and I've visited lots of food pantries and food banks along the Eastern Seaboard. And I know that there are lots of stories and there are academic articles and books about the experiences of individuals who go into food pantries. And one of the things that we've heard is that there can be some challenges. And I think it's important for food banks to take an honest look at what's happening, to try to understand if there are challenges, and if there are, try to identify ways to make improvements. And I'm really pleased to see the way the Greater Boston Food Bank is attacking this potential challenge. And I think the data that you all are collecting are going to help you understand those issues and to come up with real important solutions to better meet the needs of individuals in your communities. So I'm really pleased to see this. And one of the things I got to say, in talking about the notions of stigma and also understanding that there are multi-sectional or intersectional realities that people live in, both in terms of gender and sexual orientation and race and ethnicity, and understanding that people are complete and complex, and the services that a food bank may provide through its pantries needs to recognize those different realities. And I'm so happy that this survey is doing that work.
Well, the survey already in the results has been incredibly revealing. I mean, when we think about how the issues of affordability and inequity are being addressed across our state, you've given us a real challenge, right, to open our minds in the way that we do serve individuals and families, and to think differently, right, and to look at ways in which we can change our system in order to address and meet the person in the communities where they are across, these 351 cities and towns in the Commonwealth of Massachusetts. So thank you for that. Next question for me is, Angela, I'm going to toss this one to you. In your introduction, you shared that you are currently serving as an equity visiting scholar for Feeding America, which, first of all, I think is awesome.
Thank you.
So congratulations. And for our viewers' benefit, Feeding America is the national organization or umbrella organization of 200 food banks that are feeding this charitable food system, and Greater Boston is one of those 200s. It's made up of 200 food banks, food pantries, meal programs, shelters, mobile markets, a variety of programs that get their food. And as a member of Feeding America, we serve 600 partners across eastern Massachusetts. So there are also 2 additional Feeding America food banks which serve Worcester County and the 4 counties in western Massachusetts. So I'd love for you to tell us a little bit more about this role and why it's important to understand the gaps in equity and how that addresses these root causes within the charitable food system.
Great. Yeah. I'm extremely excited. As Norbert, I was on the board of a local food bank, the Greater Chicago Food Depository, for a decade. And to think about the local to the national scope. And there's a big emphasis now in research. We talk about implementation science and scale up. When you have so many innovative and interesting things that are happening when it comes to equity within the network. I know you do a lot of sharing of models, and just like we talked about the survey where Greater Boston Food Bank is out front with some of the measurement that's happening. We know that there's a movement across the country with food banks and thinking about this issue. And so I am the first visiting equity scholar. It was in response to the commitment that Feeding America made to equity after George Floyd. And I've been able to work with the research department to think of metrics and measures of equity. A lot of times we talk about advancing equity, but we don't have metrics and measures. And those metrics and measures should come from the ground up. They shouldn't come from research, this sort of top-down thinking. We should be able to bring what's happening within networks at the local level. And then also, what are those strategies that researchers are developing, and really put those things together. Metrics and measures should be relevant to neighbors. They should be relevant to member agencies. They should be relevant to food banks. And so part of my role this year is to think about how to engage partners sort of across the spectrum, different stakeholders and other community stakeholders to think more about measures and metrics related to equity.
Well, I really appreciate your answer. I mean, when you think about the intersectionality that you talk about, and then how we can learn from those with lived expertise, and then how we can learn how to adjust and do different and do better. And there are so many organizations that are touching food that never ever thought they would touch food since COVID specifically, and it's just an expansion. And so what you're talking about and helping us understand is that importance of how that community is going to address its needs. And it's not going to be the same for each community, right? Or it's not going to be the same foods for each community. And I think that's by your involvement with Feeding America, I think that's an incredible way to knit together some of the best work that's being done across the network. And you can't come from a better food bank in Chicago except Boston. But they do great work in Chicago. So, finally, in your professional opinions, it's important that we collect this type of data and that we use it in the wisest way. I mean, one of the ways that the food bank here in Boston collects a lot of data is we've been working with our agencies for the last years. We've been putting dollars into infrastructure and particular kind of grants. We've been listening to them and funding them in particular ways. But how and why, I guess, do you think it's important that we collect this type of data? I'll go back to it. It's not the how, but why is it important? Why is data so important, and how do you hope it'll be used?
I think data is critical. As a researcher, I can understand the need for collecting data because it sets benchmarks. And I know sometimes in our communities and different spaces, we say, well, we know there's a problem. We know that there are inequities. But unless you're collecting the data, charting it over time, you cannot begin to see what changes are actually occurring. And it actually sets up a possibility of seeing when interventions are implemented, how those changes are actually showing up or not. Um, I think it's people have lots of great ideas, and we need to have ways of evaluating those great ideas to see, are they actually making a difference? And I think the fact that the Greater Boston Food Bank is doing this work is a model that I hope other food banks are able to replicate, because collecting that data in a consistent way will allow us to understand what's happening. And so I'm hopeful for what you all are doing and its ability to spread to other locations.
Well, I mean, Angela, I want you to answer this too, but also we have seen the fact that we've done this 3 years. We're seeing how the data evolves, and we're also seeing how our understanding, especially of the DEI work, and wanting to understand, traditionally how food banks have served communities maybe for the last 40, 45 years, and how the issues that surround us now have really challenged us to think differently. And so the data is very important for us to learn from. How about your thoughts on that, Angela?
Yes, I totally agree. The data can help both assess, impact, trends that are emerging, which are so important to shape work. Uh, there's such a, you mentioned previously about the grants that you're providing to support those community organizations and member agencies. How can you assess the impact of those initiatives? And that's through data. Many times we think about research as being sort of this high level, kind of ivory tower type of thing. But data and research can be very practical, research into action, research into understanding. And so collecting data is critically important also to understand how you use your resources, and are they being used effectively? Are you really making the change that you want to see? And also be able to understand what's happening in the community. Something in the report that is striking when you think about food banks' role, the role of food banks in communities. Many times we think about food distribution, but also food banks connect people to that food and nutrition infrastructure that exists, our food assistance programs. And so that, data in the report about, are people using SNAP? Are they using WIC? How do we increase that with our normal infrastructure? It's critically important because it can also help states and food banks leverage federal resources and think more about how to address the need, not only locally, but statewide, and maybe come up with some innovative solutions to help. And I know I'm talking about innovation because really that is the key, that we have to, post-COVID, it's about doing things differently. And so part of that thinking, data can help inspire us. It can help us learn more. It can help us use our resources more effectively, but also mobilize resources that already exist. How do we connect people to existing infrastructures that are here, and make sure that people are able to get what they need?
Well said, and you both have given us a lot to think about, and there are many tools in this toolbox. It isn't just one answer. And you are correct, both of you, in being able to identify the data as such an important tool for us to listen to and understand and to see and to watch how it's moving. And then hopefully we move, right? We move with it and address what the issues are. So I just want to thank both of you for being with us. So Norbert and Angela, we really appreciate your view of the world and your contribution that you've given to this council and to this research. So we look forward to continuing our work with each of you.
Thank you.
Thank you.
As we look forward, it's important to look back. And this past year, there was a historic White House conference on hunger, nutrition, and health, the first of its kind in nearly 50 years. And last year, we saw record levels of food insecurity, and they are persisting at alarming rates. I truly believe Massachusetts has the opportunity to be a leader in this effort to end hunger. If we can leverage the data that we just heard about and the programmatic and public policy recommendations outlined in this report, and if we can do that together, then we have a chance of really making Massachusetts a food secure state. So to help close out our program today and provide an outlook for our future and how we might do this, I'd like to introduce Dr. Sarah Bleich, Harvard University Professor of Public Health and former USDA Director of Nutrition.
Hello, everyone. Thank you, Catherine, Angela, and Norbert. There are so many significant takeaways from that conversation. It is great to participate in this wonderful lecture. To close things out, I'm going to provide a policy outlook for the future and some thoughts about how government can continue to advance food and nutrition security. I come at this conversation as someone who has twice served at the U.S. Department of Agriculture, first in the Obama administration and most recently in the Biden administration. Currently, I'm the Vice Provost for Special Projects at Harvard University and charged with leading our Legacy of Slavery initiative. I'm also a professor at the Harvard Chan School of Public Health with a focus on diet-related diseases, food insecurity, and racial inequality. So I am incredibly passionate about the need to promote food and nutrition security through policy, particularly for historically underserved populations. Let me add to this rich discussion by underscoring the importance of this report by the Greater Boston Food Bank, which is one of the only food banks in the country conducting this kind of research. I also want to point out that Massachusetts is the only state to use a USDA Reach and Resiliency grant to support food insecurity research. Understanding the state of the state when it comes to food insecurity and its associated chronic diseases is critical for identifying effective solutions and for steering public policy. Without a good handle on the problem, it is very difficult to set priorities. What is clear from the report is that Massachusetts, much like the rest of the country, continues to face a hunger crisis. And like the nation, the problem of hunger in Massachusetts disproportionately impacts historically underserved populations. The good news is that there are strong government tools to help advance food and nutrition security. At the federal level, USDA administers a powerful suite of nutrition assistance programs, which serve 1 in 4 Americans over the course of a year. In my time at USDA, I had the chance to work on these programs from headquarters in DC and travel all around the country to see them firsthand. I can tell you they work. For example, SNAP, WIC, and school meals are highly effective at reducing food insecurity, improving health and well-being, or reducing healthcare costs. At the state level, here in Massachusetts, several innovative efforts have been initiated to meaningfully advance food and nutrition security. For example, Massachusetts launched an online application portal last summer that allows residents applying for Medicaid to also enroll in SNAP. This is known as the Common App and is expected to make it easier for hundreds of thousands of Massachusetts residents to access available benefits. A public-private partnership has been critical to advocating for the necessary funding to stand up this program. Another key driver of its success was the state working closely with SNAP outreach providers and advocates to bring this program to life. Massachusetts is also one of a handful of states with a Medicaid Section 1115 demonstration waiver, which makes it possible to expand coverage of food as medicine interventions to Medicaid recipients. This includes things like medically tailored meals and produce prescription programs. Many community-based partners of the Greater Boston Food Bank are participating in this program, like Community Servings, the Food Bank of Western Massachusetts, and Project Bread. Other innovative examples in the state include the Massachusetts Emergency Food Assistance Program, which provides funding to food banks to buy healthy, locally grown and produced food through the food bank's charitable food system. This program is administered by the Greater Boston Food Bank and is a national model. Another is the Healthy Incentives Program, which provides a match for SNAP recipients when they purchase produce at farmers markets and CSAs. A third is focused efforts to pass universal school meals. Massachusetts has already stepped up to ensure the extension of the federal program was continued for this school year, 2022 to 2023. A fourth is key actions by the private sector, such as the $1.4 million investment by the Boston Medical Center to open a local minority-owned healthy food market in an affordable housing development this spring. Despite these strong programs and policies, the bad news is that families are still struggling with hunger and poor nutrition. This message came through loud and clear in the report, and changes to the policy landscape are placing additional strain on families. For example, the end of the federal public health emergency, which had been in place since early 2020 and recently ended, has meant the sunsetting of many flexibilities and waivers. This includes the end of continuous Medicaid enrollment. It is estimated that as many as 15 million people, 1/6 of the 90 million individuals currently enrolled in Medicaid, could lose coverage. This is a big deal for SNAP and other federal nutrition assistance programs because millions of people join these programs through Medicaid. For example, enrollment in Medicaid confers automatic income eligibility for school meals and WIC. The end of the public health emergency also has significant implications for SNAP. For example, the emergency allotments, which allowed all SNAP households to receive an additional $95 a month in benefits or an additional benefit up to the maximum amount for their household size, have ended. What this means practically is that most SNAP participants will lose an average of $90 per month. You will not be surprised to hear me say that any reductions to the federal nutrition assistance programs put further strain on an already overburdened charitable food system. These policy changes are taking place at a time when food prices remain at an all-time high. In fact, the Greater Boston Food Bank report found the number one reason respondents said they attended a food pantry was because of the high cost of groceries. And these policy changes may dampen participation in the federal nutrition assistance programs, which will place significant strain on the emergency food network. Here in Massachusetts, that includes 4 regional food banks and the nearly 1,000 community food distribution partners they serve. And we already know that participation in the federal nutrition assistance programs is not maximized. About half of individuals who are eligible for WIC are not enrolled. 1 in 5 eligible for SNAP do not participate, and only a fraction of the children who eat school meals also participate in summer meal programs, gaps that are likely to be exacerbated by the unwinding of the public health emergency. To help advance food equity here in Massachusetts and around the country, I encourage you to look for ways to help ensure the federal nutrition assistance programs are fully utilized and to support your regional food bank or community food pantry. The Common App here in Massachusetts is a really important step forward toward maximizing program participation. And the report by the Greater Boston Food Bank shows that participation in WIC and school meals increased significantly in Massachusetts over the last 3 years. Other critical steps could include making healthy meals for all children permanent in Massachusetts, which is currently being debated and is looking like a real possibility for the state, which is fantastic. It could also include encouraging enrollment in WIC and summer feeding programs, as well as encouraging eligible families to enroll their children in school meals in the fall. Another is urging health systems to universally screen for food insecurity and refer eligible individuals to the federal nutrition assistance programs. This is a key action that was called for in the National Strategy on Hunger, Nutrition, and Health that was released at the White House conference last September, and an area where Massachusetts can improve. The Greater Boston Food Bank report found that only a fifth of participants reported being screened for food insecurity by a medical provider. All the policy recommendations I just mentioned, along with several others, are noted in the report. Coupling these with the programmatic recommendations for anti-hunger efforts also included in the report creates an opportunity for Massachusetts to really be a leader in the space. I would be remiss to not also mention the Farm Bill, which is looming on the horizon and reauthorizes several federal nutrition assistance programs, including SNAP and the Emergency Food Assistance Program, also known as TFAP. The nutrition title is by far the largest piece of the Farm Bill. It accounted for 76%, or $326 billion of the 2018 Farm Bill. This piece of legislation is a critical vehicle for strengthening the federal nutrition assistance programs. However, given the current makeup of Congress, the best posture may be to preserve and protect the significant gains over the past few years, since heated and visible policy debates may erode recent progress. Let me end by applauding the Greater Boston Food Bank for producing such a comprehensive report. This is yet another great example of how they use data to inform strategic decisions. I urge all of you to leverage this rich information in concrete ways that can advance food and nutrition security here in Massachusetts and around the country, particularly for historically underserved populations. Thank you so much for joining us today. Together, we can end hunger here.
Thank you, Dr. Bleich, for joining us for today's presentation. Thank you as well to Governor Healey, Dr. Odoms Young, Dr. Wilson, and Dr. Fiechtner for joining Catherine D'Amato for today's Ted Cutler Lecture. We appreciate each of your insights into this research and how we can leverage this data to end hunger here, together. Thank you to all who joined us virtually for the Greater Boston Food Bank's annual Ted Cutler Lecture. Thank you to the Cutler family for helping to make this program possible. And finally, we invite you to please visit gbfb.org to learn more about our hunger relief efforts or to make a donation. Together, we can end hunger here.